Hello, my name is Zalak Patel. I'm a student of Eastern Washington University. Today, I'll be speaking about my applied practice experience internship project, which I completed at my workplace. The main purpose of this project is to gain actual work experience, knowledge, and enhance my academic and professional skills. Bonnie Gordon, who is the director of nursing, was my site mentor who supervised me throughout the course and guided me in the right direction by giving appropriate suggestions and criticizing when needed so that I can improve my work skills. I completed my internship experience at Circle of Life and Adult Medical Daycare Center, which is located in Middlesex County, New Jersey. The facility provides services to the senior citizens and people with disability who receives Medicaid benefits or is able to pay through private insurance. The daycare center has to follow the rules and regulations and has to be in compliance with the NJAC, which stands for New Jersey Administrative Code. At the facility, I collaborated with different departments, including nursing, social work, transportation, dietary, and activities to improve the in-services, encourage social skills, and enhance the overall well-being of all the participants. Also to increase knowledge on health topics for all employees by providing in-services and training programs. My role during this 6-week applied practice experience internship was to gain hands-on experience and proficiency in acquiring skills and knowledge. Additionally, I was also responsible for implementing policies and procedures, delivering educational training, and conducting post-training evaluations for all the participants and employees. My major work product for the applied practice experience was developing policies and procedures for physical plant and environment, nursing, dietary, and transportation departments in compliance with NJAC. Also, I have worked on creating and implementing in-services and training programs on various health-related topics and issues to educate new and existing employees to promote safe and healthy work environment. I've modified and implemented policies and procedures in accordance with NJAC rules, utilizing facility letterhead with logo under direct supervision of my site manager. Also, I have created in-services, posters, and post-training evaluations, designed and executed in-services according to the policy and procedures using Canva and Prezi. Along with that, I've created questionnaire forms, maintenance logs, checklists, and disciplinary reports using various formats. Provided educational training to all employees on health and wellness related topics to reduce accidents and incidents utilizing PowerPoint presentations. During my applied practice experience, I have worked on egress corridor supply and storage, nursing emergency equipment, transportation policies for seatbelt and safe driving, dietary services, and drug and alcohol policies. I've also worked on educational in-services such as fire drills, infection control and hand washing techniques, transportation and wheelchair safety, maintaining professional boundaries, and adult abuse. I have used Canva, visual mapping, and PowerPoint presentations to implement policy and educational trainings, create informative posters, and establishing connections between employees, participants, and health issues, and evaluating checklists, maintaining logs, and administrative of post presentation surveys and questionnaires. The policy and procedures were developed to keep the egress corridor area clear and free of obstruction to prevent falls. All the nursing emergency equipments are kept clean, sanitized with appropriate clean wipes, replaced and removed if damaged or broken, and maintained to prevent the spread of infection. The necessary precautions were taken, for example, wearing seat belts to avoid accident-related injuries and for safety of all the participants. Also, dietary and kitchen in services are improved and kitchen logs are maintained to include food temperature, refrigerator temperature, and water temperature. Also, utilize PPE checklists to prevent the spread of infection. Also, strict drug and alcohol policy was maintained to ensure the safe and healthy work environment. During my applied practice experience, I connected my work products with competencies. Number 4, interpret results of data analysis for public health research policy and practice, in which I applied data analysis findings to develop policy and procedure, created maintenance logs and checklists, as well as the outcomes of using maintenance logs. Competency number 9, designing a population-based policy program, project, and intervention. I summarize the policy and procedure for the daycare center in compliance with New Jersey Administrative Code using facility letterhead with the logo, use temperature logs, and systematic diagram for maintaining professional boundaries using PowerPoint. For competency number 11, select methods to evaluate public health programs. Post-training evaluations were used by observing all the employees and participants. Maintenance logs were reviewed to ensure the effectiveness of the program. For competency number 19, communicate audience appropriate public health content both in written and through oral presentation. I prepared an agenda utilizing the title of the presentation, name of the presenter, date of the presentation, and the time period for the program using pamphlets and written materials. Also delivered verbal PowerPoint presentations on various health-related topics. For competency number 22, apply system thinking tools to a public health issue. I created visual mapping to connect employees, participants, and identified health-related topics and understanding how interventions impact the employees and the participants at the facility by mandating corrective actions, people being affected, appropriate measures being taken, and monitoring corrective actions using strategic planning and decision making to improve well-being of all the participants and employees. My recommendation is to provide educational training using PowerPoint presentations, Prezi, and Canva, creating posters, questionnaires, checklists, audit logs, and visual mapping to ensure the success of the project before, during, and after the implementation. Gaining insight into maintaining respect and dignity for people with disabilities and to ensure daily, weekly, and monthly application of policy and procedure to prevent incidences and accidents and to provide safe and healthy work environment for employees and participants. My difficulties and barriers for this project was that the educational training and in-service presentations was time consuming because of the availability of all the employees. Research regarding the health-related topics and issues was extensive. Few employees had issues discussing their problems and concerns during the educational training sessions. Therefore, I had to complete one-on-one in-service sessions to ensure the employees fully understand and the importance of discussing such health-related issues. Overall, my applied practice experience was informative and knowledgeable. I learned not only to develop, implement, and modify policy and procedures, but also to educate employees and participants by providing training and in services regarding many health-related topics. I'm grateful to gain an opportunity to collaborate with my site supervisor who dedicated sufficient time to review my work product and related competencies and provide appropriate feedback throughout the project. Thank you, and I appreciate for listening.